Research published just last month revealed something that shocked nephrologists. 42% of adults over 50 have elevated creatinine levels on routine blood work, and most have no idea what this means or that their kidneys are under stress. Their doctor mentions it briefly, maybe says we'll watch it, and they leave the office confused about whether this is serious or not. And what's worse, many of these people could lower their creatinine and protect their remaining kidney function with specific evidence-based interventions. But nobody's explaining what actually works versus what's internet folklore. Nobody's telling them that elevated creatinine isn't just a number, it's a warning sign that demands action. For decades, elevated creatinine has been treated as something to monitor rather than something to actively address. Your creatinine is 1.4, we'll recheck in 6 months. That's often the entire conversation. But those 6 months of inaction can mean irreversible kidney damage progresses while you wait. The truth is that creatinine elevation has specific causes, and many of those causes are modifiable. Dietary changes, medication adjustments, hydration strategies, targeted supplements, these can genuinely lower creatinine and protect kidney function. But you need to know which interventions have evidence behind them and which are worthless or dangerous. I'm Dr. Elizabeth Blackwell, and after 2 decades in medicine, I've reviewed thousands of creatinine results. I've seen patients with creatinine of 1.8 who brought it down to 1.2 with aggressive intervention and preserved their kidney function for years. I've also seen patients with creatinine of 1.5 who did nothing and progressed to dialysis within 5 years because nobody explained that their elevated number was a call to action. The difference between stable kidney function and progressive decline often comes down to understanding what creatinine actually is, what causes it to rise, and what you can do about it. But I'm not going to just give you a list of tips yet, because if I do that, you'll scan quickly, try 1 or 2 things half-heartedly, and wonder why your creatinine isn't dropping. You need to understand the fundamental biology first. You need to know what creatinine is, how your kidneys handle it, what makes it rise, and why different causes require different interventions. Comment below if you've been told you have elevated creatinine. Just yes or no. I need to see how many people are dealing with this and don't have adequate guidance. Let me tell you about Michael, because his story illustrates exactly what happens when elevated creatinine is monitored but not acted upon. Michael was 64 years old. He went for routine blood work as part of his annual physical. His creatinine came back at 1.6, up from 1.2 the previous year. His eGFR, the calculated kidney function, had dropped from 64 to 51. Michael's doctor said his kidney function had declined slightly, probably from his diabetes and high blood pressure, and they'd recheck in 6 months. The doctor didn't discuss any specific interventions beyond, keep taking your medications. Michael was concerned, but he didn't know what questions to ask. He went home and Googled how to lower creatinine. He found websites recommending herbal teas, cranberry juice, various supplements. He tried some of these. He wasn't sure if they were helping. 6 months later, repeat blood work. Creatinine was 1.9. eGFR was 43. Michael had progressed from stage 3A chronic kidney disease to stage 3B in just 6 months. His doctor now seemed more concerned, ordered an ultrasound, referred him to a nephrologist. The nephrologist took a detailed history. Michael's blood pressure had been running high despite medication. His diabetes control was suboptimal, hemoglobin A1C of 8.2. He was taking ibuprofen regularly for arthritis. He was eating a high-protein diet because he'd read protein was good for maintaining muscle mass. He was chronically mildly dehydrated because he didn't drink much water. The nephrologist was direct. Every one of these factors was contributing to Michael's rising creatinine and declining kidney function. The high blood pressure was damaging his kidney blood vessels. The poor diabetes control was causing diabetic nephropathy. The ibuprofen was directly toxic to his kidneys. The high-protein diet was increasing the workload on his already struggling kidneys. The dehydration was concentrating waste products and stressing his kidneys further. If these issues had been addressed 6 months earlier when his creatinine first rose, Michael's decline might have been prevented. Instead, 6 months of continued kidney damage had occurred while he waited and tried ineffective herbal remedies. The nephrologist made comprehensive changes, intensified blood pressure control with addition of an SGLT2 inhibitor, which has kidney protective effects, improved diabetes management, stopped the ibuprofen and switched to acetaminophen for pain, reduced Michael's protein intake to 0.8 grams per kilogram body weight, increased his water intake to at least 2 liters daily. 3 months later, Michael's creatinine had dropped to 1.6. 6 months later, it was 1.5. His eGFR had improved to 55. The kidney damage hadn't been reversed completely, but the decline had stopped and partially improved. Michael was angry that these interventions hadn't been implemented immediately when his creatinine first rose. 6 months of decline could have been prevented. Michael's story should make you understand that elevated creatinine demands action, not just monitoring, but it should also show you that the interventions that work are evidence-based medical strategies, not herbal remedies or internet tips. So let me explain exactly what creatinine is, why it rises, and what that tells us about kidney function. Creatinine is a waste product produced by your muscles from the breakdown of creatine phosphate, which is a molecule used for muscle energy. Your muscles produce creatinine at a relatively constant rate based on your muscle mass. This creatinine enters your bloodstream and is filtered by your kidneys and excreted in your urine. In healthy kidneys, creatinine is efficiently filtered out of the blood. Your blood creatinine level stays low, typically 0.6 to 1.2 milligrams per deciliter, depending on your muscle mass and other factors. When kidney function declines, creatinine filtration decreases. Creatinine starts accumulating in your blood. Your blood creatinine level rises, so creatinine is an indirect marker of kidney function. Rising creatinine indicates declining kidney filtration capacity. The higher your creatinine, the worse your kidney function. However, creatinine isn't a perfect marker. Several factors affect creatinine levels independent of kidney function. High muscle mass increases creatinine production, so muscular individuals normally have higher creatinine. Eating large amounts of cooked meat can temporarily raise creatinine because meat contains creatinine. Certain medications affect creatinine levels. Dehydration concentrates creatinine in your blood, raising levels even if kidney function hasn't changed. This is why doctors use eGFR, estimated glomerular filtration rate, rather than just creatinine alone. eGFR is calculated from your creatinine, age, sex, and race. It accounts for the fact that different people produce different amounts of creatinine. eGFR gives a better picture of actual kidney function. Normal eGFR is 90 or above, 60 to 89 is mildly reduced, 45 to 59 is moderately reduced, 30 to 44 is moderately to severely reduced, 15 to 29 is severely reduced. Below 15 is kidney failure. So when your doctor says your creatinine is elevated, what matters is both the absolute creatinine level and the calculated eGFR, and whether these are changing over time. Now let me explain the causes of elevated creatinine because understanding the cause determines what interventions will work. Cause number 1, chronic kidney disease from diabetes, hypertension, or other causes. This is the most common cause of persistently elevated creatinine. Your kidneys have been damaged by years of high blood sugar, high blood pressure, or other insults. The damage is usually irreversible, but progression can be slowed. If this is your situation, lowering creatinine requires addressing the underlying disease aggressively and protecting remaining kidney function. This means strict blood pressure control, optimal diabetes management, medications that protect kidneys like ACE inhibitors or SGLT2 inhibitors, and dietary modifications. Cause number 2, acute kidney injury from dehydration, infection, medications, or obstruction. This is sudden kidney damage that causes creatinine to spike rapidly. If caught and treated quickly, kidney function often recovers. If your creatinine was normal 6 months ago and suddenly elevated now, this suggests acute injury. Common causes include severe dehydration, urinary tract infection that spread to kidneys, new medications that are nephrotoxic, or obstruction of urine flow from kidney stones or prostate enlargement. This requires immediate evaluation to identify and treat the cause. Your creatinine may return to normal once the acute problem is resolved. Cause number 3, medication effects. Many medications raise creatinine without actually damaging kidneys. Some block creatinine secretion in the kidney tubules, causing blood levels to rise even though filtration is unchanged. Others do cause actual kidney damage. NSAIDs like ibuprofen, naproxen, and others damage kidneys with chronic use and should be avoided if you have kidney disease. ACE inhibitors and ARBs can raise creatinine slightly by changing kidney blood flow dynamics, but this doesn't represent kidney damage, and these medications actually protect kidneys long-term. Certain antibiotics, chemotherapy drugs, and many others can damage kidneys. If your creatinine rose after starting a new medication, that medication is suspect and should be reviewed with your doctor. Cause number 4, high dietary protein intake. Protein metabolism generates nitrogenous wastes including urea and creatinine. High protein intake increases the workload on your kidneys. If your kidneys are already compromised, high protein can cause creatinine to rise. Reducing protein intake to 0.6 to 0.8 grams per kilogram of body weight reduces kidney workload and often lowers creatinine. Cause number 5, dehydration. When you're dehydrated, your blood volume decreases, blood flow to your kidneys decreases, and waste products including creatinine become concentrated. Creatinine rises not because kidney function changed, but because it's concentrated in less fluid. Adequate hydration, typically 1.5 to 2 liters of water daily for most people, keeps creatinine from artificially elevating. Cause number 6, muscle breakdown. Conditions that cause rapid muscle breakdown release large amounts of creatinine into the blood. This includes rhabdomyolysis from severe muscle injury, extreme exercise, or certain medications like statins in rare cases. If creatinine spikes dramatically and you have muscle pain or dark urine, this could indicate rhabdomyolysis, which is a medical emergency. Understanding which cause applies to you determines what interventions will help. You can't lower creatinine the same way for all causes. Now let me walk through the evidence-based interventions that can lower creatinine and protect kidney function, starting with the most important. Intervention number 1. Aggressive blood pressure control, specifically targeting 120 to 130 systolic. High blood pressure is one of the leading causes of kidney damage. The kidneys filter blood through tiny blood vessels called glomeruli. High pressure damages these vessels over time. Studies, including the landmark SPRINT trial, showed that lowering systolic blood pressure to below 130 significantly slowed kidney disease progression compared to higher targets. If you have elevated creatinine, your blood pressure should be controlled aggressively. This typically requires multiple medications. ACE inhibitors or ARBs are first line because they not only lower blood pressure, but also have direct kidney protective effects. They reduce protein leakage and slow fibrosis. Many people need 3 or 4 blood pressure medications to achieve control. This isn't failure, it's necessary for kidney protection. Home blood pressure monitoring is critical. Take readings twice daily and keep a log. Share this with your doctor. Don't rely on occasional office readings which may miss poor control. Intervention number 2. Optimal diabetes control if you're diabetic. Diabetic nephropathy is the leading cause of kidney failure in the United States. High blood sugar damages kidney blood vessels and causes scarring. Target hemoglobin A1C of 7 or below for most diabetics, though individualized targets may vary. This requires monitoring blood sugar regularly, taking medications as prescribed, and working with your doctor to adjust treatment as needed. SGLT2 inhibitors, which are diabetes medications that cause you to urinate out excess sugar, have been shown in multiple large studies to dramatically slow kidney disease progression. If you're diabetic with kidney disease, you should discuss SGLT2 inhibitors with your doctor. These medications have revolutionized kidney disease treatment. Intervention number 3. Stop nephrotoxic medications, particularly NSAIDs. NSAIDs, including ibuprofen, naproxen, and others, cause kidney damage with regular use. They constrict blood vessels in the kidney, reducing blood flow. They can cause acute kidney injury and chronic kidney disease. If you have elevated creatinine, stop NSAIDs completely. Use acetaminophen for pain instead. If you need anti-inflammatory effects for arthritis, discuss alternatives like topical treatments or physical therapy with your doctor. Review all your medications and supplements with your doctor or pharmacist. Many have kidney effects you may not be aware of. Intervention number 4. Dietary protein restriction to 0.6 to 0.8 grams per kilogram body weight. For a 70 kilogram, which is 154-pound person, this means 42 to 56 grams of protein daily. This is significantly less than most Americans eat. Protein restriction reduces the workload on your kidneys and can lower creatinine and slow disease progression. Multiple studies have shown this benefit. However, protein restriction must be done carefully to avoid malnutrition. You need adequate calories from carbohydrates and fats. You need to choose high-quality proteins. Working with a renal dietitian is ideal. If you're overweight, combining protein restriction with weight loss can be very beneficial. Excess weight stresses kidneys. Intervention number 5. Adequate hydration. Dehydration stresses kidneys and raises creatinine. Most people with kidney disease should drink at least 1.5 to 2 liters of water daily, sometimes more depending on climate and activity level. However, if you have advanced kidney disease, stage 4 or 5, or if you have heart failure, fluid restriction may be necessary instead. This is individual and requires medical guidance. For most people with stage 2 or 3 kidney disease, adequate hydration helps kidneys function optimally and prevents creatinine from concentrating. Avoid excessive caffeine and alcohol, which have diuretic effects and can contribute to dehydration. Intervention number 6. Sodium restriction to less than 2 grams daily. High sodium intake raises blood pressure and causes fluid retention, both of which stress kidneys. Most Americans consume 3 to 4 grams of sodium daily, which is far too much if you have kidney disease. Sodium restriction requires reading labels on all packaged foods, avoiding restaurant meals which are very high in sodium, and cooking at home with minimal salt. This is difficult but important. Sodium restriction lowers blood pressure, reduces proteinuria, and slows kidney disease progression. Intervention number 7. Treat underlying conditions that affect kidneys. If you have urinary obstruction from an enlarged prostate, treating the prostate can improve kidney function. If you have recurrent urinary tract infections, preventing them protects kidneys. If you have autoimmune disease affecting kidneys, immunosuppressive treatment may be needed. Your nephrologist should investigate the underlying cause of your kidney disease and treat it specifically. Now let me address the supplements and alternative approaches that people ask about because there's massive amounts of misinformation online. Claim: cranberry juice lowers creatinine. Evidence: none. Cranberry may help prevent urinary tract infections by preventing bacteria from adhering to bladder walls, but it doesn't lower creatinine or improve kidney function. In fact, cranberry juice is high in potassium, which many kidney disease patients need to restrict. Claim: herbal teas and kidney cleanse products detoxify kidneys and lower creatinine. Evidence: none. Your kidneys are self-cleaning organs. They don't need detoxification. Many herbal products are nephrotoxic and can actually damage kidneys. Avoid these products. Claim: baking soda neutralizes acid and helps kidneys. Evidence: limited but some validity. Some studies have shown that sodium bicarbonate supplementation in patients with metabolic acidosis from kidney disease may slow progression. However, this should only be done under medical supervision with monitoring of blood pH and electrolytes. Don't start taking baking soda on your own. Claim: high-dose vitamin C is good for kidneys. Evidence: false and dangerous. High-dose vitamin C converts to oxalate, which can form crystals in kidneys and cause acute kidney injury, especially in people with existing kidney disease. Avoid high-dose vitamin C supplements if you have kidney disease. Claim: apple cider vinegar helps kidney function. Evidence: none. There's no evidence apple cider vinegar improves kidney function or lowers creatinine. It's acidic and could potentially worsen metabolic acidosis in kidney disease patients. Claim: increasing fiber intake lowers creatinine. Evidence: modest support. Some studies suggest that high fiber intake may reduce uremic toxin production by altering gut bacteria. Fiber is generally healthy for most people, but claims about dramatic creatinine reduction are overblown. The bottom line: stick to evidence-based interventions. Don't waste money on supplements and products that don't have legitimate research behind them. Let me tell you about Patricia because her story shows what happens when someone focuses on supplements instead of addressing the real issues. Patricia was 62 with a creatinine of 1.8 and eGFR of 38. She was worried about her kidneys. She went online and found websites recommending various herbal supplements, cranberry extract, kidney cleanse teas, and high-dose antioxidants. Patricia spent hundreds of dollars on these products. She took them religiously for 6 months. Her creatinine didn't improve. In fact, it rose to 2.1. Patricia finally saw a nephrologist. The nephrologist reviewed her situation. Patricia's blood pressure was poorly controlled, averaging 150/90. She was on a blood pressure medication, but only one, at low dose. She was eating a very high-protein diet, over 100 grams daily, because she thought protein was healthy. She was taking ibuprofen daily for back pain. The nephrologist explained that none of Patricia's supplements were going to help while these fundamental issues weren't addressed. Patricia needed intensive blood pressure control, protein restriction, and to stop the ibuprofen. Patricia was disappointed. She'd wasted 6 months and hundreds of dollars on ineffective supplements. Meanwhile, her kidney function had continued declining because the actual problems weren't being treated. The nephrologist added 2 more blood pressure medications, started an SGLT2 inhibitor, referred Patricia to a renal dietitian for protein restriction guidance, and switched her pain management to acetaminophen and physical therapy. 3 months later, Patricia's blood pressure was 120/75. She'd reduced her protein to 60 grams daily. She'd stopped ibuprofen. Her creatinine had dropped to 1.9. 6 months later, it was 1.7. Patricia wished she'd focused on evidence-based interventions from the beginning instead of wasting time on supplements. Now let me explain what you should expect when you implement these interventions because having realistic expectations is important. If your elevated creatinine is from acute kidney injury, dehydration, or a medication that's stopped, you may see dramatic improvement. Creatinine could drop significantly within days to weeks. If your elevated creatinine is from chronic kidney disease, improvements will be slower and more modest. You might see creatinine drop by 0.2 to 0.5 over 3 to 6 months of aggressive intervention. This may not sound like much, but stabilizing or slightly improving creatinine when it was previously rising is a major success. In some cases, especially with advanced kidney disease, the damage is too extensive and creatinine won't improve. The goal then becomes preventing further rise. Don't expect creatinine of 2.5 to drop to 0.9. That's unrealistic. Expect stabilization or modest improvement. Also understand that creatinine can fluctuate. A single measurement doesn't tell the whole story. You need to track trends over time. A creatinine that goes from 1.6 to 1.5 to 1.7 to 1.4 over several months is stable with normal variation. A creatinine that goes from 1.6 to 1.9 to 2.2 is clearly worsening and demands more aggressive intervention. Now let me address how often you should check creatinine, because appropriate monitoring is important. If you have stage 3 chronic kidney disease with stable creatinine, checking every 3 to 4 months is reasonable. If your creatinine is rising or you've made changes to medications or diet, check every 4 to 6 weeks until you see stabilization. If you have stage 4 or 5 kidney disease, more frequent monitoring, every 4 to 8 weeks, is appropriate. Your nephrologist will determine the right monitoring frequency for your situation. Don't obsess over every small fluctuation. Creatinine can vary by 0.1 to 0.2 day to day based on hydration, recent protein intake, and other factors. Focus on the trend over months, not individual values. Let me tell you about one more patient. His name was Robert. He was 69 with a creatinine of 1.9 from hypertensive nephrosclerosis, meaning kidney damage from years of high blood pressure. Robert was motivated to do everything possible to protect his kidneys. He worked closely with his nephrologist. They optimized his blood pressure control with 3 medications. They added an SGLT2 inhibitor, even though Robert wasn't diabetic, because recent evidence shows these help non-diabetic kidney disease too. Robert worked with a dietitian and reduced his protein to 50 grams daily. He increased his water intake to 2 liters daily. He lost 20 pounds. Over 1 year, Robert's creatinine dropped from 1.9 to 1.5. His eGFR improved from 39 to 52. He'd moved from stage 3B back to stage 3A. Robert's nephrologist told him this degree of improvement was unusual and represented the best-case scenario of aggressive, comprehensive intervention. Robert continues these measures. His kidney function has remained stable for 3 years now. He's avoided further decline and significantly delayed or potentially avoided dialysis. Robert's success came from addressing all the modifiable factors simultaneously, not from any single intervention. So let me summarize what you need to know. Elevated creatinine is a warning sign that demands action, not just monitoring. The underlying causes must be identified and addressed. The most effective interventions are aggressive blood pressure control, optimal diabetes management if diabetic, stopping nephrotoxic medications, especially NSAIDs, protein restriction, adequate hydration, and sodium restriction. SGLT2 inhibitors have revolutionized kidney disease treatment and should be considered for most patients with kidney disease. Supplements and herbal products marketed for kidneys usually don't work and can be harmful. Stick to evidence-based interventions. Work with a nephrologist and renal dietitian. Kidney disease management requires expertise. Realistic expectations. You may see modest improvement or stabilization, not dramatic reversal, especially with chronic kidney disease. Regular monitoring of creatinine and eGFR is essential to track whether interventions are working. If this video has given you evidence-based guidance on lowering creatinine and protecting your kidneys, share it with others who need this information. Subscribe to this channel for medical information based on science that can protect your health. Comment taking action if you're going to implement these evidence-based interventions. Comment my number and your creatinine level if you're comfortable sharing. You now understand what creatinine is, why it rises, and what actually works to lower it and protect your kidneys. This isn't about miracle supplements or quick fixes. It's about comprehensive, evidence-based management of kidney disease. Your kidney function is precious. Take the actions that science shows actually work.